Hello, and thanks for your interest in health coverage for everyone and in the Robert Wood Johnson Foundation. This presentation will describe an opportunity for the Foundation that plays on its strengths and can make a real contribution to American health and wellness. The Robert Wood Johnson Foundation is a major philanthropic organization with a long history of contributing to public health and awareness. Awarding nearly $300 million a year, Robert Wood Johnson is in fact the largest philanthropic organization devoted entirely to improving the public's health. With that focus, the Foundation has played a significant role in dramatically reducing smoking rates, addressing childhood obesity, covering the uninsured, and envisioning a different, better, healthier future for our country. Robert Wood Johnson uses its resources, its world-renowned research enterprise, and its vast network of partners throughout the country to find the pressure points on these key issues, and then use those points to make a meaningful and lasting impact. Specifically with expanding access to affordable insurance coverage, Robert Wood Johnson ran the very effective Cover the Uninsured Week campaign for several years, bringing national attention to the issue and ultimately making the case for passage of the Affordable Care Act and its focus on ensuring access to affordable health coverage for all Americans. Presidents going back to Harry Truman have tried to solve the nation's healthcare problems and to make sure that doctors and hospitals are available to all people who need them. Even now, more than 13% of Americans have no health insurance, which means not being able to afford the doctor and delaying care when they really need it. The Affordable Care Act was passed in 2010 to address this problem, expanding access to health insurance through subsidies that help people buy the coverage in state marketplaces. The Affordable Care Act also requires that individuals carry health insurance and that most employers provide it, and the new law provides a menu of resources and assistance options to help that happen. Polling data shows that the uninsured identify one factor overwhelmingly as the reason they do not have health insurance: the cost. Even with so much information about the ACA in the news and in our public discourse in recent years, many people are still unaware that help is available. In fact, more than 3/4 of the uninsured do not know that there is financial assistance available to help them pay their premiums and to afford their coverage. Some of the information gap is due to political disagreements and some misinformation that has tended to dominate the national discussion. This makes the challenge of informing the public even more significant. In addition to that, the rough initial rollout of the state and federal insurance marketplaces and healthcare.gov have also helped to create the perception that accessing healthcare coverage under the ACA is difficult. Most people in the U.S. get their health insurance during a specified open enrollment period, but many people can qualify to sign up for insurance at other times and because of special circumstances, which are called qualifying life events. Our goal with this campaign is to take advantage of this period between open enrollment periods to focus on those people who are eligible for coverage due to one of these qualifying life events, like those listed on the slide, and then motivate them to sign up for health insurance. We believe 3 objectives can be achieved with the campaign we've developed, including objectives that align with awareness, acceptance, and action. The awareness objective deals with the cognitive or thinking component of our message, specifically getting to the levels of information that impact understanding and retention. Our plan is to leverage and to build upon the culture of health as a way to inform people about qualifying life events that enable enrollment opportunities between designated open enrollment periods. The acceptance objective deals with the emotional or feeling component specific to levels of interest or attitude. This communications plan will help to elevate the Robert Wood Johnson Foundation's profile and its organizational integrity as a leading private resource for expanding healthcare access. The Robert Wood Johnson Foundation elicits more positive reactions and feelings than the Affordable Care Act, or than government agencies, which makes it an excellent source of credible information to the public and to those who qualify for coverage. Finally, the action objective in our plan deals with the connotative or behavioral components of opinion formation. This communications plan will therefore work to help correct the misinformation that has resulted in uninformed opinions, especially about eligibility and financial barriers that can prevent people who are truly eligible from enrolling in coverage through the Affordable Care Act. Our primary target audience is uninsured consumers and, more specifically, those people who may have unique qualifying events like marriage or a job change. The one demographic group that repeatedly is shown to have the highest uninsured rate is Hispanics, so we will heavily emphasize outreach to the Hispanic population as part of this campaign. How do we reach our target audience, the uninsured consumer? We'll talk about some specific tactics in a moment, but in its broadest sense, the most important way will be through partnerships with stakeholders that are also committed to this issue of expanding health coverage to all Americans. This includes patient advocacy organizations, physicians, healthcare professionals, insurance companies, faith-based organizations, and community organizations committed to quality of life for their part of the country. And, of course, we need to consider government agencies focused on public health and human services issues. All of this will need to be done in the context of a highly charged political climate, with a strong list of people who are opposed to having virtually anything to do with the ACA. The Robert Wood Johnson Foundation has conducted extensive research into the best messages for reaching uninsured people. Our survey work in Houston, that we'll talk a little bit more about in a minute, will further enhance this messaging for effectively engaging Hispanics. Our main message point is that consumers should be aware that qualifying events allow them to get coverage in the state marketplaces, even if it is not currently an open enrollment period. Our message platform includes the values of health and economic security, fairness, and personal responsibility. This kind of values-based framing will be important to the campaign, both in terms of reaching our target audience, the uninsured, and motivating them to action, as well as encountering the negative messages from the political and ideological opponents of the Affordable Care Act. Our tactics include various ways to leverage traditional and social media, as well as strategic partnerships and outreach. The American Beverage Association offers one model of collaborating with stakeholders to develop resources and materials, and then to help disseminate them to appropriate audiences. You can find out more about these partnerships in our paper. We will also convene a stakeholder summit to share best practices and plan for future education and awareness campaigns related to both open enrollment periods and qualifying life events. Digital advertising and promotions, including a quiz that we will host on websites and social media channels, will enhance our outreach, especially to younger and more connected audiences. Finally, a significant part of this communications plan, as mentioned earlier, is informing Hispanics about the opportunity to enroll because of qualifying life events. Our paper details a plan to conduct on-the-ground messaging research in Houston, Texas, to identify the best ways to reach eligible people and to be sure that Hispanics, who are uninsured at higher levels, have the materials and information they need to sign up for coverage. Our recommended research will help hone customized messages that address the unique cultural barriers to enrolling this demographic group in health insurance. To sum up, Robert Wood Johnson Foundation will be a central resource for the thousands of stakeholders around the country focused on expanding healthcare coverage and reducing the number of uninsured. They will be able to look to the Foundation for targeted materials, a number of outreach options, and other unique resources, such as the online quiz and digital reminder system. The secondary benefit of all this will be an enhanced standing of the Robert Wood Johnson Foundation with its extensive stakeholder and partner community. We will use several tools to evaluate the impact of our education and outreach efforts. First, we plan to utilize a national public opinion survey both before and after the campaign to measure attitudes and awareness of the Affordable Care Act, including our targeted focus of qualifying life events. Since this plan is based so significantly on partnerships, we will also need to conduct a comprehensive assessment and evaluation of both the number and impact of those partnerships. Did we truly enhance their ability to reach and enroll the uninsured, and if so, to what degree? We will also closely monitor how the online quiz and digital reminder system is used, for instance, to understand what draws people in, and if they stay engaged about the coverage conversation between enrollment periods. Finally, because this plan is ultimately aimed at reducing the number of uninsured Americans, we will utilize general information on the population as a whole from the Census Bureau to determine the impact of our campaigns and the Foundation's work. Our timeline is somewhat dynamic in case open enrollment periods are adjusted. The next one begins in November. Until then, we'll focus solely on informing people about qualifying life events that can get them coverage before then. Once November arrives, our broader messages about enrollment can be redeployed, and the cycle would continue as periods open and close. At the end of each stage, we will aggressively evaluate the impact of our work to fine-tune it for future efforts. We think there is a great opportunity here for the Robert Wood Johnson Foundation to build on its excellent work in covering the uninsured and expanding awareness of the Affordable Care Act. Qualifying life events offer yet another opportunity for the Foundation to accomplish two objectives. First, to help people get insurance, and second, to solidify the Foundation's leadership position. We hope you found this presentation compelling and that you will take a closer look at our communications plan in the paper we developed. Thanks for your time and attention.